My name is Chris Elfner. I serve as the board chair for WISHIN, and I am thrilled to welcome all of you and have you join us for this event. We're going to explore the future of health and human connectivity today, celebrate some of the strides we've made so far, and think about the future. WISHIN is the HIE, right? The Health Information Exchange. But as I look out in the room, I see people who are thinking about patients, people who are thinking about members, people who may be thinking about clients. But all of those are people. They're people that we jointly serve, people that we want to surround with care and connect the care across. So let's think today about a human information exchange, and let's think about how we can connect Wisconsin in ways that we haven't connected before and use WISHIN as a tool to get us there. Let's think about the challenges that we have and the opportunities that we have to make that connectivity. We're here. This is the wilderness, right? I think I drove around the outside. This is the wilderness resort, and it's going to be a wild day. This is no lazy river today. It's going to be a wild day talking about WISHIN's connectivity. Our connectivity at WISHIN is actually transforming the health and human landscape. We're bridging gaps between hospitals, single provider clinics, little clinics, managed care organizations, public health, even the Department of Corrections is part of our organization. So we have members across the community that are caring for individuals, and we're making those connections, right? So not only are we connecting the patient records, which we all know, not only are we connecting providers throughout the state, but we're connecting, we know at a hospital when we discharge somebody, what do? We go through the med list, we make sure that they have all the medications they need, and we send them home. But we don't know if there's food in the fridge, right? We don't know if there's a car in the garage or someone to give them a ride or someone else at the house. And today, as we speak, WISHIN is sending out alerts to the managed care organizations, helping them understand where they might need to engage with an individual to make that care better. Sending out alerts when people may be released from a correctional institution, that it's time to re-engage with that individual and help them re-engage, become an even more productive member of the community. So I want to thank you all for being part of this journey towards a more connected and integrated healthcare system. I want together for us to hear some of the stories about where we've been successful, understand where we're headed, but more importantly, talk to each other. Together we can have a conversation today in the breaks, in the rooms, off on the side, and make sure that we are not only connecting our data, but connecting each other, connecting the people, and making the most of the day. So again, thank you very much for being here. It's great to see everyone's face, and I am now going to turn it over to the team to have a conversation about the state of WISHIN. There are 4 raffle tickets right here that I was thinking about swiping, but I don't think they're mine. So yeah, I turn it over to Steve. Thanks again.
Thank you, Chris. And thank you for leading our board and being such a trusted advisor. Good morning, everybody. Welcome to the 2024 WISHIN Health Information Exchange Summit. Just have to make sure my slides are in order. Thank you. Before we get into the state of the network and my remarks, I have a few housekeeping items to attend to. First, so you're all aware and can share following this summit, this and all of our sessions will be recorded and posted on our YouTube WISHIN channel. You should have also received a pad folio and a program. If you have not, please go see the ladies at the registration desk. Make sure you pick one of those up. Also, if you haven't received a ticket, these are not Mr. Elfner's tickets, but can be sold at a reasonable price. You'll want to hold on to these. There are some giveaways at the end of the day, and we're looking forward to meeting some of those winners then. You'll also receive a link at the end of the day or sometime following the summit. This is a survey, and we encourage all of you to complete the survey, as that's input into how we can conduct and put on successful programs such as this one. And last is Wi-Fi. So all that are looking for Wi-Fi, that would be glacier_conference_center. Next, I would like to recognize our sponsors. We have 2 gold sponsors. What we will do is ask that the sponsors stand to be recognized, and there will be a video for those that provided video, or an extract from their one-pager that they've provided. Our first gold sponsor is Bamboo Health. Representing Bamboo Health, Kelly Gagnon and Chris Meehan. A video could not be provided in time, so for your viewing pleasure, an extract of their one-pager. You will also find their one-pager in the program. Our second gold sponsor is Cloudticity. We're joined from Cloudticity by Matthew Engelhart, and here is a short video from Cloudticity.
Healthcare organizations are moving to Amazon Web Services, Microsoft Azure, and Google Cloud Platform, seeking scalability, speed to market, and lower operating costs. Problem is, there's a cloud skills shortage, with 78% of organizations reporting they lack sufficient skills to support cloud. Since healthcare suffers more breaches than any other industry, journeying to the cloud can put sensitive data at risk. Get the skills, tools, and cybersecurity expertise you need without the hassle. A cloud-managed service provider can help. Learn more at cloudticity.com.
Thank you, Cloudticity, for being a gold sponsor. Next, our silver sponsors, Metastar, Rural Wisconsin Health Cooperative, Secure Exchange Solutions, and the Wisconsin Medical Society. Thank you to our silver sponsors. At the bronze level, For Medica, Health Catalyst, and My Choice Wisconsin by Molina Healthcare. Thank you to the bronze sponsors. Last, we have 4 catering sponsors: Boardman Clark, Davis Clinical Consulting and Fast Medical, United Healthcare Community Plan, and the Wisconsin Hospital Association Information Center. Thank you to our catering sponsors. Please visit our sponsors and exhibitors in the hall, as without their support, none of this would be possible. So again, I'm Steve Rottmann, the new Chief Executive Officer at WISHIN. And what an honor and privilege it is to stand here before you in this new role of 8 months and 8 years within the organization. I continue to be humbled and inspired by the incredible work we're doing as a staff, an organization, as a network as a whole. You'll notice today the theme of this summit is connected. Throughout the day, you'll hear about connections that we've made and connections we intend to make in the future. However, before I get too far into my remarks, I would like to acknowledge one individual that has breathed life into this organization. He is here with us, our predecessor, my predecessor, Joe Kahelski. Knowing Joe, he does not want this attention, but it's well earned. When he first began WISHIN and selling HIE services across the state, as he describes it, and as many of you might have already heard, it was like trying to sell the first telephone in town. Who can I call? What information will I receive? And what information can I share? Well, Joe, 14 years later, there's 2,200 sites of care connected through WISHIN, in part of your hard work and this team's work. On a personal note, 8 years ago, he took a flyer on a kid that didn't know how to spell HIE, didn't have any experience in healthcare, was a former military veteran. He worked in school districts and banks. He must have been thinking to himself, this is the guy that I've been looking for. Well, I couldn't be more grateful for the opportunities you gave me. When I started, Joe was a boss that became a mentor, and I can say today that he is truly a friend. Thank you, Joe, for everything you've done for me, this organization, the participants and patients in this great state. Thank you. Thank you all also to my brilliant staff. So I would ask that Laura, Krista, Wanda, and Keith, if you're in the room, please stand. These are the folks that enable the data movement across this network. Greg, Ashling, Carol, these are the folks that keep the operations and community and customer engagement humming day to day. Thank you. Matt Gigot leads our population health and analytics strategies, also new partnership opportunities. Thank you, Matt. Brian Meyer, I do not see. He leads our HIPAA security and information technology, making sure we're in the position we need to be securing your data that you entrust us with. So wherever Brian is, thank you, Brian. And finally, Tom Roll. He's the guy that made this event all possible. From 40 years in radio to hosting events in Wisconsin. Great job, Tom. Last, to our very supportive board. We have a number of board members, including Chair Elfner, Dr. Lotus, Dr. Rude, and many others. Thank you for the advisory. Thank you for the guidance. Thank you for all the work that you put into WISHIN. Together we're here not to reflect only on the past progress that we've made, but to envision a future that we can create together. WISHIN continues to be a leader in driving healthcare innovation in Wisconsin, and as we move forward, our mission is clear. Provide unique and indispensable value to our participants, exchanging whole person data no matter where that patient or member has received care. Apologies for being late on some slides. In order to achieve this mission, WISHIN must be focused and have conviction for what we do. That's why we are incorporating 4 fundamental pillars, that will be our guiding principles for the organization. These pillars will bring purpose to our strategic goal setting and services and support that we provide across the network. First, we're going to focus on service delivery. These are Pulse, the patient activity report, data aggregator validation program data that we send. We will continue to provide these valuable services to our network participants and look to opportunities to enhance the participant experience. Innovation. There is emphasis on completing and delivering WISHIN 2.0. I will speak to this more directly soon, as there may be questions that many of you have. We're going to be looking to move from transactional data exchange to delivering transformational healthcare delivery services, developing meaningful and long-standing state and local government relations, and new use cases to support the growing needs of our participants. As we look to continuous improvement, recurring conversations with our participants, strategic alignment so we can develop services and enhance that service delivery and innovate in a way that is meaningful to our participants. And those continuous improvement opportunities include APIs, FHIR, TEFCA, and secure web exchange services. National and local exchange. Our core is local exchange. We understand that most healthcare is delivered locally. That will continue to be our main focus, while leveraging the national exchange solutions that exist today, like the eHealth Exchange. WISHIN will identify its role to play in TEFCA over time. But as you see here, these are individual pillars that'll guide our strategic vision with a unified outcome, providing unique and indispensable value to our participants. With these pillars in mind, WISHIN is focused on moving forward. Taking a look at our Wisconsin State Seal, when we look to the future, there are so many opportunities ahead of us. Directly related to WISHIN 2.0 and enhancing WISHIN Pulse, again, this is our utmost priority at this time. We acknowledge the delays, we are moving forward from them, and have partnered with KPI Ninja, powered by Health Catalyst, to achieve the goals that are long overdue. The goal for a go live for WISHIN 2.0 is now August 2025. We understand this is pushed out much longer than anyone had anticipated, but we are solely focused in many ways to get this done. Along with WISHIN 2.0 are capabilities that we can only imagine. FHIR being one. We are already exchanging per national standards. Exploring options with FHIR and other APIs allow us to exchange data in new and unique ways, including onboarding data. Leveraging TEFCA is a strategy that we are calculating today. There are many questions related to TEFCA, including governance and downstream implications, but we understand the importance and relevance that TEFCA provides across the national landscape. Our role is to provide relevant and valuable services to our participants that are an extension of the local network. Related to local network connectivity and TEFCA is understanding the overall value. In partnership with Bamboo Health over the past month or so, we've looked at data from the past year. From August 2023, we have seen 815,000 encounters across our network and the greater network nationally that Bamboo Health provides. Only 4% of those encounters happen out of state. So it's highlighting the emphasis that while national exchange is important, local exchange is at the forefront of where we need to deliver services. We will look to securing our role in the social drivers and social determinants space. You'll hear more about our SDOH endeavors and initiatives from Matt Gigot here shortly, so I will not steal his thunder, but I am excited about the opportunities we have to be part of the whole healthcare delivery system. We'll also be focusing more and more on quality initiatives. We have achieved our 4th year of DAV certification, DAV being Data Aggregator Validation, which is an NCQA certification. I encourage you to attend the 1 p.m. breakout session to learn more about DAV and what we were doing with our participants. But further and beyond DAV is supporting healthcare and health equity measurement achievement, in addition to promoting interoperability measure opportunities that exist and may be untapped. Finally, customer engagement and alignment. This will be a huge initiative for us as we need to pour more efforts into the care and feeding of our customers. Dedication to strategic alignment and moving into new markets. Helping us achieve these goals will be through partnerships that we create. I mentioned previously KPI Ninja by Health Catalyst. KPI was a vendor that we were working with 4 years ago, recently acquired by Health Catalyst, and that partnership is growing stronger every day. And the long-term engagement that we've embarked upon with these folks is starting to come to fruition with the onboarding new data that you'll hear from Laura Widder here shortly, building on a new framework that is cloud hosted in AWS that is more flexible and scalable. And we'll continue to leverage their HIE and technical expertise to get us over the hump into WISHIN 2.0. We've also partnered with the Pharmacy Society of Wisconsin, PSW. This is bringing healthcare data at the fingertips of pharmacists, streamlining workflows, medical necessity, and other decision-making purposes, as we know that pharmacists are providing greater services to patients within the healthcare delivery system. Finally, with PSW is the onboarding, long overdue, of pharmacy data into the network. This will help providers and payers alike paint a clearer picture of a patient's health. We've also partnered with the Wisconsin Association of Free and Charitable Clinics. This offers a virtual seat at the table for those smaller and less technically sophisticated organizations that may not have an EHR, allowing clinicians to round out the community care where care is provided locally. Last, we have partnered with Davis Clinical Consulting to expand access into post-acute facilities as a tool that will enable efficient transitions of care between hospitals and facilities, while also improving the intake processes at skilled nursing facilities and assisted living facilities, allowing them to manage care in a more effective and efficient way, and visibility into readmission risks upon discharges. All of this comes together and leads to more connected network and a comprehensive network, where together we will build on the achievements of the past, tackle the challenges of today, and pave the way for a healthier tomorrow. In closing, I hope you have a great day. Our team has scheduled an informative and a collaborative experience for you all. In store, following my remarks, you'll hear from Matt Gigot and Laura Widder. Following them, we'll have a break and a keynote from Lisa Berry, Chief Executive Officer at the Civitas Networks for Health. We'll have 4 breakout sessions, 2 at 11 and 2 at 1. Choose wisely. Followed by lunch and a featured panel, which will be held in this room with Advocate Aurora, Leading Choice Network, and Bamboo Health. They will talk about the hospital and post-acute transitions of care. And then we'll wrap the day with some giveaways and a closing remarks. I'm now going to hand it off to Matt Gigot and Laura Widder to walk you through our future initiatives, highlight the current use and network growth, and offer you another look at WISHIN 2.0. Thank you, and have a great day.
Oops. All right, thank you, Steve. And as Steve mentioned, I'm Matt Gigot. I'm WISHIN's Director of Population Health and Analytics. And I'm just going to take a few minutes to talk about some future initiatives that WISHIN is currently engaged in, and then we'll hand things off to Laura Widder and Tiffany Hodgins to talk about really the current use of WISHIN today and what the future technical environment will look like. So at WISHIN, when we're thinking about the type of future initiatives that we'd like to engage in, we're really thinking about how can WISHIN help a community surround and support an individual throughout their care journey. I think Chris alluded to this a little bit in his opening remarks. We have patients in all of our communities that have really complex care environments where they're seeing many different types of providers who are helping them stay healthy and well. And so what we're thinking about when we think about future initiatives is how can we really help our participants ensure that a patient moves smoothly between those organizations as they're managing the care of those individuals and interacting with them throughout their care journey. So when we're looking for projects to work on in this space, we're really looking for projects that will allow us to, first of all, improve the knowledge of the individual and allow us to create and paint as complete a picture of that patient's care journey for our participants. And we're also looking to improve the knowledge of the populations that our participants are serving so that they can develop, or you can develop, interventions to really help accelerate the health and wellness of different populations that you're focused on. We're again looking to projects that help participants ensure care coordination and smooth patient handoffs. And also, we really want to engage in projects that involve multiple different stakeholders, which really draw upon WISHIN's very diverse participant base. So just, again, I'm going to comment on a couple of initiatives that we're currently involved in. And the first is, and Steve just alluded to this, some work around the social drivers or social determinants of health. We have heard and we know that many of our participating organizations are currently screening individuals for the social drivers of health. And we know that patients are getting screened frequently for this and are getting screened by many different organizations. And so the feedback we've received is that there's a real opportunity for WISHIN to begin exchanging that screening, SDOH screening information between organizations to really, again, create more knowledge of what risks individuals may have in this space and what opportunities there may be to get these individuals connected to the services that they need. So we're going to be implementing a pilot program this fall to begin exploring sort of the mechanics of what exchanging that data might look like. We sent out a survey this week to many of our participants asking them about how they're currently screening for the SDOH indicators, and if they'd be interested in participating in such a pilot. So if you or someone from your organization received that survey, we'd love you to fill it out because we think this is really exciting and important work, and we'd like as many participants as possible to engage in it. The next future initiative that we're currently working on is care team roster sharing. So this initiative looks to really improve the knowledge of the care team between partnering organizations. It's building upon work of a population health collaborative in Northeast Wisconsin that brings together family care, managed care organizations, hospitals and health systems, and community-based organizations. And they create a shared care team roster that allows all of the organizations who are caring for a patient to be aware of who is on that patient's care team and who should I be connecting as the patient is transitioning through the care environment. So, what we're really exploring is, can we expand those learnings to broader WISHIN participant basis and hopefully enhance care coordination and communication amongst different providers. And then finally, I just mentioned that we are also working on new population health applications. As Laura will illustrate in a minute, we have a very robust set of information on Wisconsin residents. And today, many of our participants are logging into WISHIN Pulse and looking up patient information, one patient at a time. What we're really interested in doing is being able to provide bulk information on broader populations back to the participants to help streamline some of those population health efforts and create knowledge of the population in a little bit more accessible way than we've currently been able to. So that's just a small taste of some of the things that we're focused on in terms of innovation or initiatives. We'd love to get your feedback on other things that we should be thinking about. So, please come up to a WISHIN staff member and discuss your ideas today or at any other time. So now I'll hand things over to Laura and Tiffany.
I'm a little shorter than the other guys. So, good morning. I am Laura Widder. I am the project director for WISHIN. Many people who are WISHIN participants have dealt with me and our implementation team on moving forward with WISHIN Pulse, data integration, and training your organization to use our system. I'm going to be focusing on how our network has expanded and also on what's new in WISHIN Pulse, what's coming in WISHIN Pulse, because that is the foundation of the WISHIN Health Information Exchange. So just to give you some ideas, our last summit was in 2020. Our last in-person summit was in 2020. Unfortunately, COVID struck, so we had to wait a few years before we do another one. But I wanted to talk about, what has changed, what's new. So from 2020 to 2024, we have added 376 sites of care. So our network has grown significantly. And also with our data, WISHIN Pulse, the data we provide for Health Information Exchange has grown dramatically and will continue to do so. So for example, we had a lot of data to begin with, but at 800 million ADTs, and now probably, as of today, we probably actually surpassed 2 billion ADT messages in our system. Care summaries. Our care summaries are increasing dramatically as well. So the care summary documents are those documents that are produced when a patient transitions from one care setting to another or is discharged. So we have been adding those to our network because those are basically the foundation for transitions of care. Laboratory and pathology results, we've added about 150 million of those in our system. And radiology, we've added over 10 million radiology reports in our system. So our data is increasing dramatically, the information that's available to our users. And then clinical notes is probably the biggest increase and the most dramatic. You can see just in 2024 how much more data we've received for clinical notes. And that's great because that is the most requested piece of information from our users. They want those clinical notes that happen during a visit because those have the meat of what happened in a visit. So we've added over 60 million just in 2024. So there's still more data to come. As we are moving in towards the last part of 2024, we're in the process of testing and loading data from several organizations. We're expanding data for some of the larger healthcare systems across the state. They're going to be sending not just the ADTs and labs, but they're going to be adding their clinical notes. They're going to be adding their radiology and their care summaries. So you'll be seeing a lot more of that data. And then we have new customers, and we are testing and loading their data as well. Gunderson, Fort Healthcare, HSHS, Unity Point. These are long-awaited customers that we've been hoping to have join the network, and they are here, and we will be presenting their data before the end of the year. And then in early 2025, we hope to have the Wisconsin Department of Corrections live. So they will be sending their clinical data to our system and be able to use our system to get clinical data for treating people who are incarcerated. And then we're also, another initiative that we're working on that's very interesting is we're going to have some deeper integration with Image Trend. You'll hear more about that in the breakout session, but with Image Trend, we are working with them with one organization right now. We hope to expand to other organizations to get the EMS run sheets into our system. And then also we're making our data available to Image Trend so that when EMS goes out on a call, they can have access to the patient information right away on their way to the call or before the call, so they have all the information they need to care for a patient. WISHIN Pulse itself, the usage, that has increased dramatically as well. We're at record usage right now. You can see from 2020 to, I'm projecting to the end of 2024, but we have 125 organizations actively using WISHIN Pulse. We have several sites of care. We have several organizations who haven't quite implemented the use of WISHIN Pulse yet. And if you haven't been using WISHIN Pulse and you want to, please reach out to WISHIN. We're happy to help. We have over 17,000 users. In 2024, we had about 450,000 logins and over 800,000, almost 900,000 patient queries in our system. And then the records viewed. So every single record you view, every lab result, every clinical note, everything like that, over 5 million this year. So that'll be a record high as well. As I mentioned again, if you are interested in getting hooked up to WISHIN Pulse and you're not using it right now, you can reach out to our WISHIN support team. You can reach out to me directly. You can reach out to basically any staff member of WISHIN, and we will get you hooked up. So with WISHIN Pulse, we have some new services that we've added since 2020, and also I'm going to give you a sneak peek of WISHIN 2.0. So this has been talked about by a couple other people, but we do have the DAV status, the Data Aggregator Validation Program. We did receive certification by NCQA. Our certification right now lasts through December 2024, and it includes over 1,200 sites of care with hospital, outpatient, and diagnostic information. We have different EHR systems, Epic, eClinicalWorks, Cerner, NextGen, Meditech. So there's a lot of data available in this program right now. And when we do our next cohort, or the next certification, all of our new customers are going to be added to that, so our network will even grow more for the HEDIS quality reporting and be able to produce information for the payers, reduce the chart chase, for the payers and also for the healthcare systems. And for more information about that, please come to the breakout session this afternoon. Another new service that we really haven't talked about much is electronic case reporting support. So we do have several customers who are using WISHIN's direct messaging service for electronic case reporting. A lot of our Epic customers, and we're now starting to implement with Meditech. So the Meditech customers will be able to use WISHIN direct messaging for electronic case reporting as well. This is something that it's a relatively new service, and it's very easy to set up on the WISHIN side at least. But if you are looking for a way to do electronic case reporting, again, feel free to reach out to WISHIN. We will be happy to help. Now I want to give you a sneak peek of WISHIN 2.0. It's been a while since we have done this. So I want to talk a little bit about what's coming in our next generation of WISHIN Pulse and what you can expect for new features. So first of all, we're doing expanded search capabilities. So you can still search by the patient's medical record number and their name. That's usually the key way to search, and date of birth. We've added the ability to search by address. This could be extremely helpful for especially EMS services. If they are called to an address but they don't know who the patient is, they may be able to search by that address. My favorite, personally, is the My Patients list. So this is going to allow you to create a dashboard of sorts of the patients you manage, their care. You'll be able to select a patient, add it to your favorites list, and then every morning you can come in and look at your dashboard and see your list of patients. There's links directly to their medical records, and you'll also be able to see when their last visits were. So you can sort by who had an ED visit last night. You can sort by the last ED visit and see right on top who's had any activity, and be able to then go into the medical record and see what happened. We also are adding some things to the tabs, the detailed clinical record. So in the visit history tab, we're putting alerts right on the top of the page for important information. So you can see right there, does the patient have any severe allergies? Does the patient have any abnormal lab results recently? Any recent ED visits? You'll be able to see all of that and link right to it. We also will have links to external systems right on the front page as well to make it easier to access the immunization registry and the Wisconsin EPDMP, prescription drug monitoring program. So they're not kind of buried like they were in our old system or current system. And then of course there is the super CCDA. So that will allow you to pick and choose information you want to export into a patient's clinical record and create a care summary document and choose the format, and then export data. Excuse me. We're also going to be taking CCDA information, or care summary document information, that we have received from contributing organizations, parse that into the actual clinical record instead of just having them as standalone documents. And you'll be able to combine the data from the care summaries plus all of the data we receive in other interfaces into one comprehensive medical record. And then one final thing that we've seen a need for, definitely, is anything that's in a list view on our tabs. So if you're looking at the patient's diagnoses, you're looking at the patient's visit history, procedures, any of those list views will be exportable into like a CSV format. So you can easily print out, here's a list of the patient's diagnoses if you want to print out the patient's diagnoses. Here's the patient's visits history. You'll be able to print all of that out. And I'm going to turn it over to Tiffany Hodgins, who's going to talk a little bit about more of the expanded features of WISHIN 2.0 and how WISHIN and its partnership with the Ninja Universe is going to be expanding the capabilities of WISHIN.
Hi there. I'm Tiffany. I'm Tiffany Hodgins. I'm the VP of Client Delivery with KPI Ninja by Health Catalyst. And our platform allows views for timelines and trends. It's a visual representation of the patient's visits over a period of time, categorized by patient class. So it offers you a 1 month, 3 month, 6 month, a full year to date, a full year, or you can view them as all. We also have lab result trends. The lab result trends are a visual representation of the last 100 results, allowing those providers a quick view to help identify trends that may not be evident just over a few tests. One of my favorite features is the key indicators, and the key indicators are the 4 main: BMI, A1C, blood pressure, and the LDL trends. It gives a comprehensive view of the patient's overall health for monitoring patients' health over time. And each one of those you can click into and it'll take you directly to that specific lab result. So over the last few years, there's really been an influx or a time for transition. Funding program models have changed. Payer providers' statuses are becoming more interested in HIE data. So we're looking at moving more from transactional data into more of a population health enablers. So moving beyond just simply facilitating the exchange of data between healthcare entities, and we're focusing more on providing a unified real-time view of the patient's information across the care continuum. It's allowing us to evolve support for population health initiatives and leveraging data to improve patient outcomes. Unlike our historical traditional data brokers who handled static data, WISHIN and other HIEs are providing that real-time data, enabling providers to make those immediately informed decisions. We're increasing and expanding data sources outside of those non-traditional sources, like they said previously, the social determinants of health, your EMS, your Department of Corrections, your medications and pharmacy data, and ultimately enhancing the data governance and data quality, moving away from just facilitating the data exchange to really ensuring the data quality and accuracy and security of that data. So we look forward to all of that. And now we have questions.
I'd like to invite the rest of the speakers from this to come up in case there are questions. And also, we have some of our implementation team who will be coming around with microphones. So if anybody does have a question for anyone who's been speaking, please raise your hand and we'll come to you with a mic.
Laura, real quick. Quick clarification on our DAV certification. The DAV certification extends through December of 2025, not 2024. So just an oversight on the slides, but that certification does exist for another year and a half. But any questions? I know this is Wisconsin and we are afraid to raise our hand and be the first to ask. Okay, we will not put you on the spot. What you can do is pull any of us aside at any point, ask all the questions you'd like. And what we can do, and I'll look to Greg to help facilitate, any of these questions that we have, we can pull together and create a frequently asked questions or questions asked at the summit, either privately or publicly, which is just fine. With that, you have now more than a 5-minute break. Oh, we do have one. Somebody was brave enough. There we go.
Easy question. Will there be any sort of demo of the new features?
Yes, as soon as we have a working demo environment, we will be probably doing a lot of different sessions. We'll also make demos available pre-recorded that you'll be able to see. Right now, we're not to a working system yet, but when we do have a working demo environment, we will do all the demos anyone would like.
I'll add to that, our current system is on the WISHIN YouTube channel. So there is an 8-minute tutorial of the current system that you can review and stop and start at your pleasure or leisure. And if you have additional questions, you can schedule a real demo of the current system with Laura and her team. Okay.
What is the timeline for the 2.0? Do you have a timeline yet, or?
August of 25. So some might remember it was a different date many, many years ago. But again, we're letting the past be the past and moving forward. 2025, August. And there will be many, many communications that are put out as we get closer and closer to that date.
So, excuse me, for your new data contributors, when will that information be available to your DAV subscribers?
Wow. We will have to take them through the next cohort. So the next cohort we are looking at the very latest, starting in a 2025 cohort. We may consider, if we are able to, and WISHIN 2.0 and other things have calmed down a little bit, we might be able to start them earlier. But at the very latest, they would be in our next cohort to be able to provide that information and have them certified along with our other organizations.
So by saying the next cohort, does that mean not until December of 2025 when you go through the recertification, or is it sometime sooner than that?
The recertification process usually starts sooner. So we either do a January or a July cohort, depending upon the schedules and what kind of data we have available with new contributors. So then it gets certified for probably 2026 data and moving forward.
So I'm just going to add another clarification here, right? Because so for HEDIS, when people are filing their HEDIS information, we can utilize non-certified data. We just need to go through an audit process for it. So the sooner we can get access to that information, the better.
So, Shelley, these are great questions. Let's separate the two. There's non-standard certified data, which you were just making remarks about, that have to go through primary source verification with your HEDIS auditors. We are constructing some type of delivery mechanism with KPI. I'm looking at Tiffany on this one, and Matt, where we can soon provide certified and non-certified. Then you'll have to manage how you ingest that into your HEDIS systems, and this goes with any health plan that's using us for DAV certified or non-certified data. As far as DAV certification, the earliest cohort we would get in is July of 25, and that is a 18, 19 week process, give or take, which gets us typically or historically December of 25 is when that data, we would receive a final report from NCQA how that data can be used. So that's, at that time, we would determine, is this certified data that your HEDIS auditors should accept as is, or does it go through the path of your own primary source verification? So next cohort, July 25, getting us to early mid-December report. And then it's up to you guys how you might ingest that non-certified data while we're going through that certification process. But we're happy to have this and any other conversation as in-depth as you want as you start preparing for your chart chase now for the measure year 24 and for measure year 25. Any other questions? Great questions. Appreciate that. Okay, so we will let you go into a break. Again, please take time to visit our exhibitors in the hallway. We will meet back here for our keynote from Lisa Berry at 10:05. Thank you.